Hi, I'm Dr. Praveen Koduru. I'm a practicing general and laparoscopic surgeon, and I'm a specialist in hernia and proctology. I have fellowships in robotic surgery, in hernia surgery, and proctology. I bring you greetings from Sree Nandaka Laparoscopy and Laser Center. Today, I want to address an important and often uncomfortable topic, piles, also known as hemorrhoids. Basically, what is piles? Symptoms and treatment for piles, also known as hemorrhoids, are the basically swollen and inflamed blood vessels in and around rectum and anal canal. Not only the blood vessels, but often the anal cushions. They're engorged and they prolapse out of the anal opening, and patients feel while they're passing bowel movements. Symptoms of piles include painless bleeding during bowel movements, itching and irritation, pain or discomfort while passing stools, and also after passing stools when the person sits in his office chair doing his regular work, and also a swelling or a lump coming out of anal canal, which hurts when the person suffering from piles sits on a chair or in their car seat or when they are working. Piles are also associated with mucus discharge, which sometimes become quite irritating and causes intense scratching or itching at that region. So treatment for piles are pretty simple. So they include, the first main thing is diet and lifestyle changes. The second treatment option is over-the-counter medication and some ointments, which I'll be describing in detail again. Then you have prescription medication that is exclusively prescribed by the coloproctologist. And finally, if the resolution doesn't happen with medication, then you have some surgical options, which include some minimally invasive procedures like rubber band ligation, sclerotherapy, or infrared coagulation. Or finally, then you have the most advanced laser surgery for piles. To discuss the points I have said earlier, I want to elaborate on each treatment option, like the first one, which is the diet and lifestyle change, where the person needs to have a normal regular diet which includes eating high fiber, drinking a lot of water, should not take any oily or fried foods, and also food on time. Then no late night eating, and not to do with any alcohol or smoking. And to discuss about the over-the-counter medication and ointments, Isabgol husk is an OTC medication which helps bulk up stool and helps in prevention of piles. And also there are some ointments available like a Pilex cream or a Smuth cream, which helps. They don't prevent the formation of piles, but they help a patient suffering with piles pass painless stool. And coming to prescription medication, doctors usually prescribe prescription medication for piles, which include tablets like Daflon, which are involved in increasing the mucosal integrity, as well as some ointments which cause decreased inflammation at the site of piles, as well as some laxatives which help the patient to pass stools without any straining. Finally, let's come to the surgical procedures, which include minimally invasive procedures like rubber band ligation or a sclerotherapy, where we inject some sclerosant into the site, as well as infrared coagulation, where we use infrared light to treat the piles. Basically, they are all OP procedures. The patient comes to our OP, get these things done, and they're back to their house within an hour. So, failing these procedures or in advanced piles, we usually suggest them a surgical procedure which involves excision of piles, or the latest, now we are using laser to treat piles. The advantage of using a laser for piles include no scar, no pain, early removal, same day discharge, and going back to work the very next day, and very low recurrence rates. Remember, early intervention and a healthy lifestyle can make a significant difference. If you have any concerns or questions, don't hesitate to reach out to a qualified doctor. For further information, please subscribe my channel. I'll be putting out regular updates on piles. Thank you.